Hello everyone. In this session, I would like to cover fibroids and women's health. Fibroids are benign tumors which affects 20 to 30% of women in reproductive age group. Fibroids can have varied symptoms like heavy bleeding, painful menstruation, heaviness in lower abdomen and lower back pain, etc. In few cases, fibroids can be totally asymptomatic and it can be an incidental clinical or ultrasonographic finding. In very rare cases, fibroids can get transformed into a cancerous growth. Otherwise, by and large, it is a benign tumor. Maybe less than 1 in 1,000 or 1 in 10,000 can get transformed into a cancerous tumor. So how do we diagnose fibroids? By and large, by doing an ultrasonography, we can diagnose the fibroid. The fibroids are different types depending on the site. It can be within the muscular layer of the uterus, what is known as intramural. It can be at the surface of the uterus, what is known as serosal fibroids, and what is sometimes it can be within the cavity of the uterus, what is known as submucosal fibroids. Whatever be the site of fibroids, it invariably produces certain symptoms. And if patient is symptomatic, we need to treat it. Or if the size of the fibroid is more than 5 centimeters, then we need to manage it clinically. So how do we approach the management? When we look at the management, we can actually treat it medically if it is a small fibroid and patient is symptomatic, especially if she is having lot of bleeding and the fibroid is less than 5 centimeters. But in certain cases, the position or the site of fibroid is in such an anatomical region that it will not respond to the medical treatment and we need to approach it surgically. When we talk about surgical management of fibroids, it can be the conventional surgeries, which we still do it in large fibroids, or it can be a endoscopic or laparoscopic, commonly known as keyhole surgeries. So we do keyhole surgeries for all 3 types of fibroids, and it has got excellent results because we can remove only the fibroids and the recovery is very fast and patient can go back to her routines within 2 weeks of the surgery. In certain cases, if the person who is already completed her reproductive functions and she is above the age of 45, then we do consider hysterectomy. Hysterectomy is the total removal of uterus along with the fibroid. This is done because in many cases fibroids have a recurrence nature. So if it recurs, then another surgery is planned. So in order to avoid, if the fibroid is very big and if the woman has completed 45 years of age, we do give this option of hysterectomy. Nowadays, there are medications, especially coils like Mirena coil, which are put in if the endometrial cavity is not affected by the fibroid and the size of the fibroid is less than 5 centimeters. So Mirena is a medicated coil with progesterone, which elutes a small quantity of progesterone to the uterine cavity. So once we insert this Mirena coil, it takes care of the symptoms for the next 5 to 6 years. So overall, when we talk about fibroids are treatable conditions. These are the tumors, benign tumors in the uterus, which can be cured by surgical approach, and you do not have to worry so much about the cancerous transformation because there is very little chance that fibroids get transformed into a cancerous growth. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.